All right. Thank you. So today we are glad to have you, colleagues, for joining us today in these palliative care sessions. This is the platform created for all people, especially those involved in care and palliative care delivery in Eswatini and outside, for the purpose of helping us share our best practices and experiences and shape how we can best meet the needs of our clients who have life-limiting and threatening conditions. So we are holding these sessions every first Wednesday of the month. So like we are having it today. This is our fourth session. In 2026, we are focusing on self-care, especially for those who are providing the service and those involved directly or indirectly in the care of those who are sick or diagnosed with life-limiting and threatening conditions. We understand that even though we are dealing with patients all the time, but there is time that we need to come back and then take care of ourselves. In the last session, we were with a psychologist, Spesihle, who was taking us through how best we can cope with grief and loss, and sharing the best practices that we can adopt as providers or practitioners. What a wonderful session was. Even today, it still sounds in my mind that indeed, without us, there is no care for the patients. Before that session, I attended another webinar where we were learning about the value of self-care in palliative care. So self-care is a very valuable element in the care of the sick, and how we take care of ourselves determine how the quality of care our patients will receive and the quality of life we are going to live thereafter the service duration that we are in. So we need to take care of our lives, regardless of the compassion we may have, the desire to pour ourselves out there for the patients and jump for them. But we need to take care of ourselves because that one is very important. And I believe all of us and those who were in management could see that having a self-wellness program, having an established mechanisms in an institution that will drive wellness initiatives is not a smaller investment, but it's a real investment into the growth and achievement of the mandates that the organizations are existing to achieve. Because after all, we, the human force in the organizations, we are the best resource that organization may ever have. So having us with all that we have is very critical. So at policy management-wise and the personal level, we were learning how best we can take care of ourselves, especially now that we know that one way or the other, in palliative care, we are exposed to losses in every day, and we are the first, if not second level, people who experience grief and loss in our lifetime. So we need to take care of ourselves. So we're learning about that, but if ever you will need to catch up with that session, you can visit my YouTube channel, Mahlangu, MNS, Sandile, what am I saying? But if you check Mahlangu MNS, you'll find it in YouTube. I always upload our videos there. You will get this very inspirational presentation that we have. So today we are looking at, now that we have learned about how to take care of ourselves in as far as loss is concerned and dealing with the losses that we have at work, personally, families, everywhere we go, we have losses, and these losses are shaping our lives. One of the things that we are also faced with in palliative care is handling and dealing with communication skills and as far as handling difficult conversations. My colleagues in the hospice can agree and attest that really the issue of handling difficult conversations is a daily meal in palliative care. So we will be learning on that as far as we are helping ourselves and our colleagues, sometimes we have to break news to one another. How do we handle such conversations? If ever you are the one who's a recipient trusted with this difficult news, how do we go about in communication, especially when issues are bad? So today we are going to be learning about that, and we have our social worker, Mercy, with her long-time experience in providing palliative care. I'm hoping we will get the opportunity to learn more on how best we can do it. So I'm requesting that we give her the opportunity to present. Mercy, may I give you this opportunity to go ahead with your presentation?
Thank you, Mr. Mahlangu. Good afternoon, colleagues. My name is Shabangu, as Mr. Mahlangu has introduced me. I hope I am audible enough.
Very well.
Thank you. I hope the presentation is showing very well. I've already shared the screen. Is it reflecting on your side?
It's okay, but maybe if you would like, you can also put it on presentation mode.
Okay. Thank
Yeah,
you.
we can see it.
Okay. Please forgive me, colleagues. I have a bit of flu, but I'm hoping that So today's topic is effective communication skills for sensitive topics. We are quickly going to go through the outline. We are going to look at the definition, benefits of communication, of effective communication. We're going to look at sensitive topics, effective communication skills, nonverbal skills, and environmental factors. Supporting clients who have difficulty speaking, supporting clients with deafness or hearing loss, supporting clients with learning disabilities, and navigating ethical dilemmas. So effective communication is a dialogical process that balances the exchange of medical information with deep emotional support. It focuses on understanding the patient's values and preferences to ensure that their care aligns with their goals for quality of life. So today we will discuss these skills which will enable us to facilitate more open and honest and compassionate communication with our patients and their families, especially the ones who are facing end-of-life decisions and in situations of ethical dilemmas. So as Mr. Mahlangu mentioned, we are covering topics on self-care this year. So we have decided to include communication skills in our self-care package because communication is directly linked to self-care in the sense that it provides healthcare workers with what we can call emotional armor, which acts as a psychological barrier or boundary. And it also acts as a defensive strategy that can be used to protect one's mental well-being while dealing with traumatic cases and even high-pressure social interactions, which is some of the things that we encounter on a daily basis working with people with life-limiting conditions. So learning about effective communications is beneficial to us, and practicing it is part of self-care. We will look at the benefits of effective communication, and these benefits are for us as healthcare workers. I am hoping that as we go through these benefits, we will be encouraged effective communication skills and practice them not just for our clients, but also for ourselves. So the first benefit that we are going to look at is that it reduces emotional exhaustion and burnout. So, effective communication empowers you as a healthcare worker with empathy management, where you are able to gain understanding about a patient's feelings without taking those feelings home. I think last session here too, the psychologist was able to see how can we make sure that and when we go home, we are able to be our normal selves. So lana-ke ukuthi sikhona uku-understand the patient's feelings without taking them home. And loku kuyasisita to prevent the emotional contagion that often tends to fuel a burnout. So that is the first benefit of effective communication. The second one is that it increases professional self-efficacy and it boosts confidence. I think we can agree, colleagues, that one of the major drivers of healthcare stress is the feeling of being ill-equipped for difficult conversations, among a lot of other things. So if you are well equipped with the necessary skills, this gives you some kind of internal conviction that you can apply those skills and achieve the desired outcomes. And this is a very key component of psychological resilience. The third benefit is skill mastery. So the more you practice effective communication, you tend to feel more competent. And this means that you are less likely to experience anxiety during patient interactions. And this results to a greater, say, overall job satisfaction. And then the last benefit is time management. When there is poor communication, usually repetitive explanations or even misunderstandings that may, as you're engaging the client, they take up so much time. So could be utilized for the activities, whether refreshing ones or activities that are work related. So to avoid low, we can use the right skills for communication. But before seeing Ulama skills, I would like for us to look at some of the sensitive topics that you find that on a daily basis we come across or we engage in as we work with our clients. One of the first sensitive topic is breaking bad news, followed by treatment options. I will request colleagues to see in depth, especially the ones that we have covered before. So I would encourage you to go back to some of our videos, especially if you missed those sessions. We do have a video on YouTube where we were talking about communication and breaking bad news. So this is where some of the things are unpacked at length or in depth. So there's breaking bad news, treatment options, communicating a prognosis, referring the client to or admission to a palliative care program, spiritual and religious needs. Lapha-ke sibuka how cultural and spiritual values can be incorporated into the client's care plan. Those are some of the issues now dealing with spirituality, they can be quite tricky. There's also advanced care planning, transition to comfort care, where the discussion shifts from curative treatment to comfort-focused care, where aggressive interventions are no longer effective or desired. And then another topic is preferred place of death and bereavement planning. So these are the skills that we can use to communicate effectively to our clients. The first one is active listening. So with active listening, you actively listen to what the client is saying and concentrate on what they are telling you, rather than what you might respond with. So Lana, you also have to check if you've understood what the client is telling you and be honest if as you are engaging with the client. Also, part of active listening involves creating a quiet space, a quiet and a private space for having or holding the conversation with the client. So in such cases, you have to be mindful of your body language. What is usually encouraged is that you use an open body language, like maintaining good eye contact and having an open posture where your arms and your legs are not crossed. This tends to help clients would say feel more at ease when you are presenting yourself in that way. It is also important to allow silence. There are moments where silence is silence shouldn't be awkward as you are engaging with your client, because it gives time for the client to process the information without interruption, and it helps the client to be able to react emotionally. And usually the silence, we call it therapeutic silence. The second that we can use is using honest and clear language. So using direct and simple terms whilst avoiding jargon to discuss whether the prognosis or the dying process, it helps to avoid confusion or even giving false hope to the client. So here you can share information in a way that the client can understand. It can include things like writing words down or using objects or even pictures where necessary. You can also, or you also have to check if the client understands important information by asking that client to repeat what you said, preferably in his or her own words. Then another skill is asking probing questions. So instead of just explaining to the client, you can ask open-ended questions. I'll make an example. You can ask a question like, what are your biggest worries? Or what is important to you right now? You can also ask other questions like, what questions do you have for me? Instead of asking a closed questions like, do you understand? So this gives the client room to be able to express themselves further without maybe giving you yes or no answers, which are very shallow. You can also ask the client, how are you feeling? Instead of asking them, are you feeling better? So that is how you can use probing questions. Then another technique, which we did discuss in one of our presentations, I think, le communication. So you can also go back to that presentation, colleagues. It's the ask, tell, ask technique. So what happens here? You ask the client what they know, and then you tell them or share with them the information clearly. JavaScript, we avoid jargon and we use a clear and honest language. Then you then ask the client for their understanding to see if they are following and if they got what you are saying clearly. There is also the nest technique, which you can use for empathetic responding. Here, you help the client to name the emotion as you're engaging with the client. Maybe you see that the client is upset. You can then say to the client, I see that you are angry. Now you are naming the emotion. And then the U stands for understanding and empathy. So you can then show understanding and empathy. After naming what the emotion is, you show understanding and empathy, maybe by using words like, I can't imagine what that has been like. Maybe instead of using, I understand what you are going through. Then the R stands for respect. This is where you actually encourage the client, or you kind of like praise them, where you can say things like, you've done so much. So this is actually encouraging to the client, and it shows that their emotions and feelings are being validated. Then with the S, you offer support. This is where now you share with the client what you will do in terms of maybe your scope of work, how far you will assist them, and where you cannot assist them, you have a way of linking them to the next service provider. So you can say things like, we will be here for you. And then the E stands for explore, where now you can engage the client by saying, tell me more about some of those emotions that you will be discussing with the client. So that's another skill that we can use for effective communication. And then another one that we can use is validating emotions. So by acknowledging fear, sadness, or anger expressed by the client and allowing the client to share his or her feelings without interruptions, you can be able to use, say, techniques like nodding or maintaining eye level to show engagement, but ensure that you do not interrupt the client at any point. It is essential to encourage clients to talk about their fears and worries in a calm and safe environment. And it is very key to listen without judgment, because what the patient is saying is important to them, as I've mentioned before. It is also important not to try to fix their emotional problems. What you can do, which can be helpful to the client, is asking open questions, and allow them to speak freely or express themselves freely about how they are feeling and what they are going through. There are cases where the client is too stressed or tired to talk. In those cases, you may let the client know that you can talk another time. There's no pressure to discuss everything at that particular time. But uzame not to give too much information at once to the client. You observe your client, how are they taking or processing and then, so in a situation where the client is tired or is too stressed about what you're sharing with them, you let them know that you can engage them another time. But it is important to highlight the information that you believe is most is very important, and then set up another time to meet with the client. Okay, there are also nonverbal skills and environmental factors. I didn't mention a lot because I'll just mention only three. There is a physical setup. Logunya says before, but we'll just look into it namanje. So there's physical setup where you find an environment that makes communication easier. That should be environment where there are not distractions, which is a quiet and private space where without any interruptions. And this is where you make sure that now you sit at eye level with the patient, and you maintain that open body posture as you are engaging with the client, which is the arms and legs that are not crossed. Then nota under environmental factors is cultural sensitivity. It is important to be aware that cultural norms and social hierarchies significantly influence how death and dying are viewed and discussed. So you are not, you should try not to find yourself saying things that will be offensive or will be considered inconsiderate to the client, because this may be perceived as by the client as disrespectful or even hurtful. Then still under nonverbal, to observe a lot. You should observe any expressions by the client, be it facial expressions, their body movements, which may signal that the client is in pain, or that the client has fear that they are even unable to voice at the moment. Then now we are going to look at clients who have difficulty speaking. So effective communication colleagues should enable us to engage all kinds of clients, because all my clients are so we should not be hindered in providing service or even in communicating freely with our clients. Hence, how can we communicate with clients who have difficulty speaking. So, it is to give the client plenty of time to speak. The client really pressured or somehow limited as express. So we give them plenty of time, no matter how slow the client speaks, no matter even if the client stammers a lot, you just give them enough time to speak. We should also avoid interrupting or finishing sentences for them. Ngoba lokhu kubese kubenza babe discouraged and ukhanze ukuthi now usayi-engage leyo client leyo because uyamcacelela, they'll just go for whatever you are saying, bajale ukuthi nje that session or consultation ibe over quick because you're not giving them the opportunity to express themselves. Basically kuvela ngazuthi the client was like sebayakubambelela or they are taking up so much time. So it is important not to interrupt them or finish their sentences for them. It is also important to look at them when they are speaking. It shows that you are giving the client full attention. It shows that you are interested and you are not bored. And it shows that you are comfortable with them. But you are comfortable with that. And then it is important to reduce background noise and other distractions because you might find that the client takes even longer to express themselves because so they even lose their trail of thought because of all the interactions that happen. And then to be honest, if you do not understand what the client is saying, it is not right, colleagues, to pretend like you understand client because sometimes clients can find this upsetting or even patronizing. At some point, if you continue pretending like you can understand what the client is saying, where it will catch up with you and expose you what was the client saying all along. And the client from that will completely shut down because so I lose and trust how transparent and you're not honest to the client. There are also other materials that can be used with such clients where we can use materials like pictures or even symbols. Sometimes maybe there can be applications either on phones or on tablets that the clients can use to express themselves further. Now, so those are some of the things that we can use with clients who have difficulty in speaking. Then we also have clients with deafness or hearing loss. So as you engage this client, you need to find out how they prefer to communicate, all other things that the client is not comfortable with. It is also important to organize for a sign language interpreter if need be, and making sure that the client can see your face clearly. Even in situations where maybe you are wearing your PPE or your face mask, it is advisable that you at least use clear ones so that the client can be able to see your mouth movements. Also, we can speak clearly, but try not to exaggerate the mouth movements with the client so that and then we can speak at a normal volume because sometimes shouting can be uncomfortable for patients. Maybe Emma hearing aids. So use a normal volume and make sure that you don't exaggerate your mouth movements. And also always check if the client is able to understand what you are saying. Then we will move to clients with learning disabilities. So clients with learning disabilities may find it difficult to understand new or complicated information. So you may find that they need extra support with reading, writing, or even understanding information. So here we need to note that the level of someone's learning disability will affect how much support the client needs in terms of communication. So indlela singabasapotha ngayo It is to learn how they like to communicate. Maybe they like to use communication aids such as pictures or a certain application, so that can help us in terms of now communicating with the client, be it prognosis, be it advanced care planning, anything discuss sensitive topics. You can also find out if they need support to communicate, and in this case, you can even include people who know them better, as we communicate with the client. We also have to avoid jargon and unclear language at all costs. So we use simpler terms that make sense to the client. It is also important to find out how the client expresses discomfort or pain, because non-verbal skills that we use in communication. So this is where we'll read if the client is still comfortable, if the client is in pain, if the client is anxious for any reason. We can allow enough time for conversations. With such clients, it is very important to be patient and be ready to repeat yourself if there is a need. Other things, just take time with this patient, because some of the topics that's are life-changing. So this person needs to be understood and make informed decisions about their care. Check if the client understands, and ask them to repeat what you were saying to them, but ask them to do that in their own words as we communicate with them. It is also important to ask open-ended questions, like what questions do you have for me? Which parts do you feel I should repeat, or do you understand? So those are, instead of saying do you understand? So I think that is how we can phrase our questions as we talk or engage with our clients. Then lastly, colleagues, we are going to look at ethical dilemmas and how to navigate them so that our communication is effective. The first one is facilitating shared decision making. Okay, we did discuss other ethical dilemmas before my presentations. I will not go through those. We are just going to focus on these ones for today. So here, the is that we are usually shifting from what can be done to what should be done. And the focus in this case should be on the patient's previously stated values and goals, which is why we are always encouraged to see the goals of care discussions with our clients, send them advanced care plannings with our clients, because this is where they come into play. When they go my decisions, but to see the mindful of what the client initially wants. And these are double goals of care. They change from time to time. Advanced care plans change from time to time. As you continuously engage the client, you are able to make note of these things. The second dilemma is managing conflict. So sometimes there can be conflicting opinions between, say, family members. So it is important when you're in a situation where there are conflicting opinions between you should acknowledge those conflicting opinions. You should also validate them and then work towards mediating them. But you ensure that you keep focus on the patient's known wishes. So we come across, I think, in terms of my issues are conflicting opinions between family members or even family members and the client. So because our care is client-centered, it is important to make sure that as a SIBA engager, we don't leave them out, we engage them directly, but we make sure that the client is at the center of care, is a priority. And the third dilemma is navigating uncertainty. So there are situations where there's so much uncertainty, maybe around issues of treatment options, or even issues of end of life, maybe time frames. So what helps here is being honest about the inability to predict how the client will respond to treatment or the exact timeframes of that disease trajectory. But as you do this, you ensure that you continue focusing on the comfort and quality of life, your client. The fourth, I think this is the fourth dilemma, which is collusion. So at times, family members will not want certain information to be shared with the client. So here you have to address the family's request to withhold information from the patient by exploring ayini lama-fears ale family yobona ukuthi bathi mhlawumbe sicela le information lena angatshelwa yona. But at the same time, as you explore those fears ale family, you should honor the patient's right to know, because it is important for the client to be informed about everything in their care. But at the end of the day, they are the ones that need to make a decision. So this one can be quite tricky. You have to be very careful when you can do it. But it is important to what they would say client autonomy and self-determination is key. Okay, yeah, my client helpful. And then the last ethical dilemma is cultural humility. Here you have to acknowledge that social hierarchies and cultural norms deeply influence how different families and individuals approach issues of illness, treatment, death, and end-of-life decisions. This then informs which models or interventions you would use to support the client or family. So in conclusion, effective communication acts as a protective buffer for mental health care. For the mental health of healthcare workers, while enabling them to provide compassionate care and offer realistic hope effectively to support clients and families in distress. Applying effective communication skills for sensitive topics gives healthcare workers the ability to apply practical tools needed to navigate a high-stress environment, even in situations where there are ethical dilemmas. Thank you, colleagues, for listening to me.
Thank you. That was a very wonderful presentation. I can see there's already a hand or is a clap. Maybe this time around, let me just say thank you for sharing this. As the presentation is going through, I'm just thinking of what usually happens out there. In the last session, you were talking about these issues of how to cope with this environment we work in. And then today we are dealing with this one sensitive issue of communicating. When you have failed to help the patients, you come bent out and stuff. But when we have communicated very well with our patients will be involved in the care. And think of it when families are not coping and not working together. There are those conflicts the social worker has mentioned here, and you don't have the right tools to help you cope with that, because the conflicts of the family will end up affecting your service delivery, and you will finally see yourself as an unproductive team member, yet you are, but the issue was communication. Thank you so much, Mercy. But let me open this opportunity for anyone who may want to comment. You want to add, you want to share an experience, you want to ask a question, the social worker is here. You can ask a question, you can share a comment, you can add, you can clarify you can share anything that has to do with this aspect of our lives and the care. So if you can't unmute or signal in where you are, you can write on chat. We will read the chat for the team. So we have the time. I think from now we have 20 minutes to discuss if that calls for. So anyone with a comment, a question, any clarity? Effective communication is very key in our lives. It makes us more effective and more efficient. But I'm looking for, maybe you can stop the sharing message, so I can see maybe other people will see the hands. Mr. Matenja is saying, thank you, Mercy. Thank you. And then Nampumelelo is saying, thank you, Mercy, for the wonderful presentation. Communication is a skill we need to continually learn and engage with our patients to better ourselves. Yeah, it's a skill. Unfortunately, we are not born with. Sometimes we go for training without it. Sometimes we exit training still without it. But we can still learn. Those are the good news about it. It's something we can still learn. I can see Spiwe says the presentation was so enlightening. So from Spiwe saying that it was enlightening. Yeah, anyone with a comment, team? It's something we learn. Without it, we harm the patients and we harm ourselves. And then self-care wise, we go the south way. We go the other way around, we go south. Instead of north, we go south. Negative way. So then we are unable to achieve what we were looking for. Yes. Anyone else who may want to share? It can be an experience, it can be a question. If there is something you have a question, in some of the issues Messi said there that they are so sensitive to talk with, they include in our culture, they include the sexuality related discussions with our patients. You know, when you are a 22-year-old service provider and then you have a 50-year-old married couple in front of you, and then you don't know what to do. They are almost your parents, you know. But understanding how to deal with this, it's a very vital component. So effective communication then will rescue us in that area, so we can know how best we can move with those difficult conversations. One of the things that usually happens, remember these people we are dealing with, some of them, they are going through the Kubler-Ross grief journey. Some are in denial, some are in bargain, you know. They have they're in different modes. So some of them will push you to a certain level in such a way that because you are not comfortable, you can end up lying to the patient because you just want to send them away from your presence. So you will be challenged and you will have a problem now how to deal with this. Before I take Mieza, there is a Mage Government.
Okay. Thank you. Good afternoon, Balingani.
Yes, good to see.
Thank you, Mercy, for such an informative presentation. My comment is less skilless is needed across the board, because if something is unclearly communicated to a person, it affects health status of that individual. And then the buck stops with the healthcare worker. When I will be trying to communicate whatever has been presented to you, not knowing the real source of the problem was another message that was wrongly communicated. So in short, I'm saying, thank you for this. I wish we could all embrace it and by a proper communication and the skill that we need to communicate difficult news to people. It could be either there is no money, there is no what, but as long as it is a bad news, the scale is essential to us all. Thank you.
Thank you, Kametse. Yeah, as Mike Kametse is sharing, I'm just thinking of the simplest bad news we have ever broken as clinicians when drugs are out of stock. Sometimes the damage is not that the drugs are out of stock, but how have I presented the situation that drugs are out of stock? Am I helping the patient to cope with it, or I'm destroying the patient fully? But specifically, I was saying the presentation was wonderful. So thank you for it. Though it joined late, but it's hoping that it's glad that the presentations have been already uploaded. Yes, the PDF or the presentation has been uploaded to the platform, so it's already available. You are free to use it. You can even take it and train other colleagues who didn't attend this session. But also the video will be uploaded in the YouTube by the end of today. It will be already there. I think by 4 p.m. it will be already running. So you can still go back and listen, and other presentations that are already there. You can find even our psychologist presentation is still in my YouTube. You can still visit it there and you'll find Mahlango MNS, you'll find it there and connect the dots. And then Mpumelelo was, what I used to notice is we tend to impose our beliefs and values on our clients, but on a good note, siyezama. Kupuma from that, as we continually learn and expose to such forums. Yeah, that's true. You know, if you are a person of a certain belief, you quickly, actually what I've understood now, in as far as dealing with this, I would say these are hopeless conditions when you look closer. So when you see the situation and you can tell the prognosis is looking south, it's not going to where we are looking for. It is easier to quickly pull on your hope tool, or to quickly pull on your strength. Say what gives you strength in such a situation, and feel like if I can give the patient this is the last solution I have. Unfortunately, solutions are from the patient, not us. We share information, and then patient come up with a solution out of it. Then they can share, I'm thinking this is what is going to work. And then we share information on that issue. So if this is the situation, this is what we can give as information to the patient to consider in whatever direction. But that's true, because that's what normally happens. Yeah, we pull on that, and then we impose our values, what we think it doesn't work for us, and then we think it's not going to work for patients. You know, sometimes patients choose the opposite that we ever thought of, and it works for them. And it doesn't work for us, and totally against even how we value things. But if it's for the patient and it's working, then it's good for them. Yeah, but anyone else that I may be leaving behind? This was a very presentation that we need, colleagues. And one thing I've learned that let's allow ourselves to fail. But let's not fail to try again and again. It's when we practice communication, when we do trainings on this, when we do physical trainings, we even set up presentation and written demonstration, because this is a skill that we learn by doing. And when we do it is when we learn to understand how best we can do and how difficult it is to go through bad news. And let's embrace the same scenario when we address one another as colleagues, when we help one another, when we address situations with one another as colleagues for our self-care. It is very important that we understand how to handle those difficult news that we have in a workplace together. They are very important, and they help us to cope with our losses and griefs and with other people's needs and situations. But when we can't be able to communicate, then we will begin to mistreat other people and at the end hurt ourselves. But if there is no other question, let me prepare for us to close. Let me announce that in our next session in June, we are going to have another 100% direct session to us and in our well-being as healthcare workers. You can see and visit our iEco platform and check the program. It's fully packed and it's a little bit personal. When you're reading it, it will become personal to you. You will see that it is indeed here to help us deal with our pain and deal with our core challenges and empower us to be productive healthcare workers. So in our next session, we'll be looking at emotional safety and peer support. So we'll be having our psychologist back in June on the 3rd. So we are inviting you. Let's bring in most of our colleagues here, even those who are the support staff. Let them join, let them register and be part with you when you are joining. Register them. Remember, this program has certificates at the end. So if you attend fully, you will get the certificate on this self-care session we are having. So we'll be looking at emotional safety and peer support. So let them come. So we'll be learning because this is one of our areas, the emotional side as healthcare workers or as service providers. So we'll be learning then the importance of this and how best we can leverage on it and keep on our lives and attend and be able to be productive in our lives and helping our clients. So wishing all you the best. Bye-bye.